heart attacks.
Hmm.
I mean, it's not something any of us really want to think about, right?
Right.
But they're a lot more common than we might think. So today we're diving deep into heart attacks with the Heart Foundation as our guide. You wanted to really understand what's going on, so
Yeah.
think of it as your crash course, straight from the experts.
Well, I think what's so interesting about heart attacks is they seem kind of mysterious, but when you break it down, it's all about basic biology.
Yeah, so the Heart Foundation, they start with that analogy of the heart as a pump, like it's a fist-sized powerhouse.
Right.
And honestly, I never really got that analogy until I actually dug
Right.
into it this time.
Yeah, it makes a lot more sense if you think about what it's actually pumping. Oxygen-rich blood. So it's this delivery system that literally keeps every single cell in your body alive. Right.
And the coronary arteries are like the VIP lanes, making sure the heart, which is the delivery system itself, gets its own life support.
So a heart attack is basically like a traffic jam in those VIP lanes.
Exactly. And that traffic jam is usually caused by this buildup of plaque in the arteries.
Mm-hmm.
So if you imagine your arteries are like pipes, right?
Yeah.
This gunk, this plaque, which is made of fat and cholesterol and all sorts of stuff, starts sticking to the inside of the pipes, narrowing them.
Okay, so we've all heard about plaque, but I'm guessing it's not just hanging out in there harmlessly.
You're right. It's more like it's setting the stage for a heart attack.
Okay.
What often happens is that a piece of this plaque breaks off, and that suddenly blocks the artery.
Oh, wow. And that's where the trouble really starts, because that means that the heart muscle is not getting the oxygen it needs.
And the longer that blockage sits there, the more damage.
Exactly. Time is critical when it comes to heart attacks. That's why recognizing those signs and getting help immediately is so important.
And that, I think, is a really good segue
Yeah.
to the next part of this. So we talked about what's going on, like, inside the body,
Right.
but how does it actually feel? Like, what are the warning signs?
Well, that's where things get really interesting. I mean, we always hear about chest pain.
Right.
And while that's common, it's not always the whole story. The Heart Foundation, they actually list a whole bunch of symptoms, and some of them, well, they're kind of surprising.
Oh, okay.
Yeah.
Like, what kind of surprising things are we talking about?
Well, you got to think about it, right? Your heart is working so hard keeping your whole body going.
Yeah.
So when it's in distress, you might feel it in all sorts of ways. I mean, chest discomfort, sure,
Right.
but also dizziness, nausea, sweating, even pain in your jaw or your neck or your back.
Oh, wow. Okay. So not exactly like clutching your arm and falling over.
Exactly. And that's kind of the problem with those Hollywood heart attack scenes, right?
Yeah.
They just don't always, they just miss the mark. The Heart Foundation, they make it really clear that no two heart attacks are the same.
Which makes sense, right?
Yeah.
Because everyone's body's different. Right. But that also makes it really tricky to know if you're having like a heart attack
Yeah.
or just had like a bad burrito.
Right. And that's why the Heart Foundation, they're so adamant about this. When in doubt, you call for help. Seriously. Don't wait. Every minute counts.
So say you've called the ambulance,
Right.
sirens are blaring, you get to the hospital. What happens when you get there?
Well, it pretty much becomes a race against time.
Okay.
The medical team, their top priority is to restore the blood flow to your heart as quickly as possible.
Okay, so how do they actually do that?
Well, they'll use a bunch of different tests to figure out exactly what's going on with your heart
Mm-hmm.
and where that blockage is.
Okay.
And then they'll usually use a combination of medications and, in some cases, surgical procedures.
It's like a two-pronged approach.
Exactly. Some medications are like the first responders. Like, you've got your clot-busting drugs that work super quickly to break up that blockage.
Right.
And then you've got medications that are more for long-term support. So like blood thinners to try to prevent future clots, and medications that can actually help your heart work more efficiently.
Okay, so that's the medication side of things.
Right.
What about surgical procedures?
Yeah, so the Heart Foundation, they talk about two main procedures, angioplasty and bypass surgery.
Right.
Angioplasty is actually, it's kind of amazing. So imagine this is this tiny little balloon that they inflate inside the artery, like little miniature angioplasty balloon, and that pushes the plaque aside.
Wow. They can actually do that.
Yeah. And they'll often put in a stent, which is like a little mesh tube to help keep that artery open.
So it's like scaffolding for your artery.
Exactly.
That is wild. Okay, and what about bypass surgery?
So that's a little more involved. Basically, they're creating kind of a detour around the blockage by using a healthy blood vessel from somewhere else in your body.
Wow. It's really amazing what they can do these days, like with that angioplasty
I know, right?
and the bypass surgery. So it sounds like, recovery is definitely possible after a heart attack.
Oh, absolutely. The Heart Foundation actually points out that around 150 Australians are hospitalized for a heart attack every single day.
Wow.
So that's a lot of people. But it also means that there's this like huge network of experience and support out there.
Yeah, that's a good point. You're not in it alone.
Exactly. And it's not just about surviving a heart attack.
Right.
It's about thriving afterwards.
Right.
And that's where cardiac rehabilitation comes in.
Right. The Heart Foundation mentioned that. What exactly is cardiac rehab?
So think of it kind of like physical therapy, but for your heart, right?
Okay.
It's a structured program that combines exercise, education, and support
Okay.
to help you regain strength, improve your heart health, and reduce the risk of future problems.
So it's really taking like a holistic approach
Exactly.
to recovery, not just the physical stuff.
Exactly. I mean,
Yeah.
they teach you about all sorts of healthy lifestyle choices,
Right.
like eating a balanced diet, how to manage stress.
Mm.
They basically give you the tools and the confidence to really take control of your heart health.
So knowledge really is power when it comes to all of this. And speaking of knowledge, one thing that really struck me in all of this is that emphasis on prevention.
Oh, absolutely. It's not just about reacting to a heart attack, but it's about reducing your risk in the first place. And the Heart Foundation has some really clear steps you can take to do that.
Okay, like what? So what are some of those steps that people can take?
Well, first and foremost, talk to your doctor.
Right.
Get that heart health check.
Yeah.
They can assess your individual risk factors, things like family history, high blood pressure, cholesterol levels.
Because what might be a red flag for one person could be totally normal for somebody else.
Exactly. And beyond that, it's really about just making those healthy lifestyle choices.
Right.
Eating right, getting some exercise, quitting smoking, managing that stress, all those things we know are good for us.
Mm-hmm. But sometimes we need a little reminder.
Exactly.
Yeah.
Because they really can make a big difference.
Yeah. Well, I think that's a good place to wrap up. So we've learned that heart attacks are serious, but understanding the signs, getting help right away, and focusing on prevention, those are the keys.
Couldn't have said it better myself. And remember, this whole deep dive, it's focused on Australia based on the information you gave me.
Right.
But these insights about heart health, they're important no matter where you live.
Absolutely. So until next time, everyone, get curious, stay informed, and most importantly, stay heart healthy.